It is important to understand that if we think of the different forms, the different clinical forms of multiple sclerosis that we refer to, secondary progressive, relapsing, remitting disease, clinically isolated syndrome, or primary progressive disease, it is important to keep in mind that we are referring to a clinical behavior. In relapsing remitting disease, the patient has occasionally attacks, recovers, but is stable in between attacks. That is distinct in secondary progressive disease, which follows relapsing remitting disease. During secondary progressive disease, during the secondary progressive phase, the patient may or may not have attacks, and the patient continues to accumulate new disability independent of attacks. So recently, the FDA has essentially taken multiple sclerosis and has separated it into different states. We have at the very beginning clinically isolated syndrome, we have relapsing remitting MS, and new we have secondary progressive MS divided into two different conditions, if you want to, active secondary progressive MS and inactive secondary progressive MS. So active secondary progressive MS refers to patients that have over the last year had either an attack and have experienced continued progression, or had new MRI lesions and have experienced continued lesions, versus patients that have not had such recognizable inflammatory activity over the last year. So while there is a lot of discussion regarding active or inactive secondary progressive disease, one also needs to keep in mind that this refers to a recent, within the last year, feature of having or not having recognizable inflammatory activity. In the past, active secondary progressive MS, relapsing remitting MS, and clinically isolated syndrome were very often subsumized under the title relapsing forms of multiple sclerosis. Recently, as I mentioned, the FDA has taken this apart and essentially given agents approval for CIS, relapsing remitting MS, active secondary progressive MS. At this point in time, the payers have not specifically dedicated inactive secondary progressive MS to any agents that are currently marketed. Important here is also to keep in mind, if a patient is on medication, the patient may have progression without necessarily having new MRI lesions or a new attack. So if this patient that is on medication doesn't show inflammatory features, the clinical practitioner doesn't necessarily know whether this is because the inflammation is kept in check by the medications that the patient is on, or whether the progressions that this patient experiences is due to injury to the central nervous system that has occurred months or years before. If such a patient then would stop medication, it is a possibility that inflammatory activity returns in that particular patient. So the terms active, inactive, as outlined, are temporary features of a patient. And it's also important to keep in mind what else is going on. Is the patient on treatment? Is the patient not on treatment? Because this may further modify what we actually observe.